For this week's presentation, I will be presenting a case about a 28-year-old Hispanic female, which I saw at the clinic on Wednesday. She presented with a 2-day history of left temporal region headache that was going on for about 2 days. She described the headache as a pulsating to throbbing type headache, which she rated 4 out of 10 on the visit. She has been taking 325 to 650 milligrams of PRN Tylenol at home with mild relief. The pain kind of waxes and wanes throughout the day, but the day I saw her, she said she woke up with that headache. She used this kind of hand gesture to describe her headache, which she said is kind of throbbing sensation. Some relieving factors includes just being by herself in a dark room and away from her family members seemed to alleviate the pain. Aggravating factors included bright light and loud noises. Under the review of symptoms, she denied any fever, no chills, no speech disturbances, no unilateral generalized weakness, no vision loss or visual disturbances. She denied any auditory visual hallucination, no memory problems, no sensory disturbances such as limb paresthesia, no abdominal pain, no vomiting, diarrhea, trauma or injury to her head, no history of seizures, no tremors. She did complain, however, of nausea but no vomiting. Medical surgical history, she does not have any medical problems. She had a tonsillectomy when she was 10 years of age, appendectomy at age 16 with no complications. She's gravid 2, period 2. She has 2 girls at home, overall healthy. She had C-section on both, full term, no complications. She does not take any prescribed medication. She has been taking PRN Tylenol at home for a headache. She's not allergic to any food or medications. No sibling. Her mom is healthy. Her father had a stroke in 2014 with no residual deficits. He has history of hypertension. He's a smoker and is on medication therapy. Social history, is married to her husband for past 8 years with 2 beautiful children. She works at a family-owned Mexican restaurant. She doesn't smoke. She doesn't do any drugs. She does drink socially. She says she has about 1 to 2 glasses of white wine occasionally at home. She did state that she has been under a lot of stress recently because of the COVID-19 and a significant decrease in the number of customers she sees at the restaurant, which is family owned, and they have been pretty much closed the restaurant for the past 2.5 weeks. So financial burden, she said, is one of the significant stresses for her at this time. Under objective assessment of vital signs was normal. She was afebrile. She is 5'2", 135 pounds, BMI of 24.7, which is normal. On exam, she was awake alert oriented times 4. Her cranial nerves 2 to 12 was intact. Negative Kernig sign, negative Burdinsky sign. Other neurological assessment finding was unremarkable. Her lung assessment was unremarkable, and her cardiac assessment was unremarkable as well. According to the American Academy of Family Physicians, she met the criteria for acute episodic migraine without aura. This is in accordance with the International Headache Society diagnostic criteria for migraine, which has 4 criteria. Headache that's lasting between 40 to 72 hours. The second is at least 2 of the following: avoidance of routine physical activity, moderate to severe pain, pulsating quality, unilateral location. During headache, at least 1 of the following: nausea or vomiting, photophobia and phonophobia. And third is not attributed to another disorder. And fourth, being headache for at least 5 attacks, fulfilling above criteria. Differentials included acute episodic migraine, meningitis and tension type headache. I went with the acute episodic migraine, which according to the American Academy of Family Physicians 2018 is 0 to 14 headaches per month. Meningitis unlikely because no fever and negative meningeal irritation signs. Tension type headache unlikely because tension type usually present bilaterally. They are non-pulsating in quality with no associated nausea and vomiting. The treatment included non-pharmacological treatment, which is recognition and avoidance of provoking factors such as dietary environmental factors. She told me she is currently going through a lot of stress because financial issue at this time because of the pandemic. I did talk to her about relaxation, and I actually talked to her about mindful meditation, which she has practiced that before, and she says she will try to practice it during this stressful times. Pharmacological included ibuprofen 600 milligrams, Q 6 hours PRN. After I presented the case to my preceptor, we decided to just stick with ibuprofen at this time because it's a safety profile, and with a follow-up in a week. And if she's still having headache, then we might try triptan or sumatriptan, which is the first line migraine abortive treatment approved. She doesn't qualify prophylactic migraine therapy at this time because one of the criteria is to have 4 headaches per month or 8 headache days per month, or overuse of acute medications. Other education which I included in her visit is to keep a headache diary, which includes identifying triggers. For example, number of days, documenting therapeutic response, and once you recognize the triggers, then she can avoid it to prevent a reoccurrence of this headache. I did not, or my preceptor felt that we need to do any kind of imaging and blood work because examination finding was totally not indicated for doing any kind of imaging at this time. I have a follow-up with her next week, and hopefully I can update you guys more on this patient. Thank you very much.